Hello and welcome to Debra and Peter are doing a podcast with me, Peter, and you, Debra.
Hi, morning, Peter. Loving
Morning,
the sweatshirt,
Debra.
little design.
Yeah, how about that? I'm not wearing a proper shirt today. I've worn a proper shirt a lot this week. I'm getting back into business in a fairly serious way. We should talk about that sometime. But meanwhile, this is the week in which our esteemed Secretary of State for Health and Social Care, Wes Streeting, formerly of the voluntary sector, has vowed to break the culture of the voluntary sector and the way it lobbies government. And I know you've got a few thoughts about this, Debra. And so, why not tell us what you really think?
I will. I'll try not to be as sort of underspoken and understated as I usually am, Peter. Because I hadn't seen this. What happened was I was contacted by a number of fellow chief execs in the sector complaining about this, and I hadn't heard what he'd said. So my initial thing, I began from government has to make some very difficult decisions, etc., etc., etc. I can understand why sometimes things aren't a priority. And then someone then sent me the link to what he said, and I went from being sort of calm and reasonable to being absolutely furious at the language that he actually used. And what particularly cross about it was this sort of notion, well, two sort of things about it really, Peter. This notion that charities have to subsume, you're not a priority, so shut up and go away. It's like we can't do that. Like if I said to you, Peter, when you were leading NSPCC, look, children aren't a priority right now. It's, something else. So shut up, Peter, and go away. You just wouldn't have done that. It's like, because it's your job to campaign for the safety and protection of our children. And this notion that he said something like, they're not stakeholders, they're partners. He was referring specifically to the Royal Osteoporosis Society. But of course, that remark can be taken generally across all charities. And I thought, I'm really there you have it. It's this complete understanding that NHS cannot function without the work of charities. They just can't.
No.
Takes the older people to their hospital appointments. There are a whole load of charities in the UK who fundraise for heart machines and baby monitors and what they call baby, those special not incinerators. Oh my God, forgive me. Venters, that's the word I'm looking for like premature babies and things like that. Actually turn up and volunteer. I mean, I went to visit my aunt in hospital the other day, and the people that came round to help with like making her comfortable, all the rest of it, were not the nurses, they were the volunteers who come and help. So it's first feeling that somehow we're a nuisance rather than an absolutely critical part of provision. Really, really, really wound me up. Really egregious. Context of the government that absolutely before they won the election, they came and they did a society roundtable where they said, we think you are really important. We want to be partners. We want to reset the relationship because let's face it, the relationship between charities and the state has been shit for the last 14 years. And so they said all of that, and then they reinforced it when they got into government. The Prime Minister even wrote the civil society leaders to say, this is an incredibly important partnership that we're in with you. And yet you get one of the most senior ministers in the country using such dismissive, such ridiculous words. Now, I can forgive that to a certain degree, apart from, how does he not get it? Without us, I looked at some stats. NHS charities alone, so that doesn't include things like community transport associations or anything like that, like contribute £1 million a day to the NHS. That's £365 million a year that the government would otherwise have to find. So it's just the stupidity of it. And we've just done all this work on the covenant, which is supposed to be initiated by DCMS under the leadership of the Prime Minister, where we're supposed to have this deal between the state and between charities about how we engage with each other, how we treat each other as partners, how we're respectful and all the rest of it. And we have done loads of work, Peter, on our side, consulting, building it up, feeding into it, seen absolutely no sign of engagement from the other side. And my colleagues have been saying to me, well, Deborah, it'll come, be patient, etc. And no, I'm sorry, I don't believe it. If somebody as senior as the health secretary can say what he said about charities and his view of charities, then clearly that's going to be a view that seeps across most of government and the state, both in the form of local authorities and ICBs and all the rest of it. So it was a dickish thing to say. And I liked Wes Streeting. I quite like him. But what a stupid thing to say. And Stern is massively pissed off those people that he needs to help him deliver his vision for the NHS. Was that clear enough?
Yeah, okay. So you feel quite strongly about it then.
I do.
And I did see the article that you wrote for Third Sector about this, and it's received a lot of attention and praise and encouragement from the sector. I mean, Wes Streeting has clearly touched a nerve here, and I'd and ahed about arguing with you on social media, but I thought, no, we've got a podcast.
I never argue on social media, Peter, ever. So even if you had, I wouldn't have argued back.
We should argue here. I've always been pretty sceptical about the covenant, and I think I wouldn't encourage. And we'd had a conversation about love-ins with the sector and not being taken in by any of that. So perhaps that's that is disappointing. I'm with you 100% on the co-production versus stakeholder management, and I've said this to civil servants a lot, that very often we feel in the charitable sector like we are being managed, and people are appointed to manage us as stakeholders as opposed to engage and involve us in the development of solutions that achieve outcomes for the people that they're seeking to help. And there's something fundamentally problematic about that. So that I don't think was great language. But I think that there is something. He's got a point, and I can't and don't want to relate it to the Royal Osteoporosis Society because I don't know what they were and weren't doing. But I have seen some. Let's just go back a bit. Another thing which is really important for charities is to be relentlessly focused and passionate about their mission and the people that they are here to serve and speak for. And so giving voice to those who are less likely to be heard is a vital part of what we're about. That is not the same as achieving system reform and transformational outcomes for the people who would benefit from achieving our charitable purpose. And so I think this is where charities can be frustrating to secretaries of state or civil servants. So, when I was in the Treasury, we would receive piles and piles of letters from charities who simply said, give us more money because these people need more help. They probably do need more help, but if all you do in your argument is say, we need more money because we're really important, well, how important are you relative to everyone else? And government is about choices. And so I kind of appreciate and sympathise with those people who are receiving arguments from charities that something should be done, but they're stopping short of anything beyond saying, give us some more money. Now, they're giving voice, and that's an important function of what they're doing, but that's not, I think, the way to achieve change unless you're extremely fortunate and you find rather randomly a particular politician who's got some authority that for a short period of time will put your need above all sorts of other needs. Education, oh my goodness, the number of well-meaning charities, public affairs departments who believe that schools should be teaching X, Y, or Z. Again, very well meaning. Their priority, their charitable purpose was to advance a particular bit of knowledge or a particular cause on behalf of certain people who weren't getting what they wanted or needed at the moment. But again, if your performance measures are simply as the charity to make a lot of noise about this or to get a little bit more money or to tick a few boxes to say that you have achieved change for your cause, that again, I say, is not the same as achieving system reform for all schools. So I would receive, when I was director of secondary education at the DfE, all sorts of moans, arguments from special interest groups of one kind or another who were being passionate about their charity and their cause, and an articulating voice which might not otherwise be heard. But their solution was, we should have a target for our narrow interest. We should have, in the Ofsted inspection, a particular scrutiny of this one aspect of childhood that matters more to us than anything else. We should write into the national curriculum that this subject matter is more important than anything else. We should insert into teacher training or the qualification for head teachers particular requirements in relation to this issue. And you do despair after a while if that is the default position of individual charities, because while they are operating to a model which is voicing their particular need or concern, actually, we're not going to transform the outcomes for all children if we end up with a regime in which everything is a priority, every special interest has a target, the inspection process takes 3 weeks because they're having to inspect 55 different aspects of childhood. The national curriculum is stuffed full of so many detailed requirements and responsibilities that teachers have no time to think or engage with the pupils in front of them. So I think he's on to something in terms of some of the less thoughtful, narrow, agitating that special interest groups do when they seek to move beyond giving voice to the issue that they're concerned about and into developing solutions without appreciating the context of those who are needing to deliver in a more complicated environment. So that's what I thought he was. That's where I thought, do you know what? I agree with Wes Streeting. There is something about this kind of painting by numbers approach to public affairs that some campaigners are not doing a great service by, in simply saying, give us some more money, give us a target.
But not doing great service to who, Peter? So here's the thing again. I get being a government minister, being government is a massively complex job. Working in the civil service, working in the treasury, you've got all these competing interests that you have to then decide and prioritise. And whatever you decide to do, somebody isn't going to like it. I get all that. Chose to do it, you're in government. It's not our problem. And in fact, if you think about charity specifically, it's the job of a charity to deliver for its beneficiaries against its charitable objects. That's its job. Of the Royal Osteoporosis Society or NSPCC or Macmillan or Alzheimer's to say, look, there's a bigger issue here. Actually, their problem over there is more important. The government's told us that, so we need to back off. Absolutely not. About it is, I've had this battle all the time, and you and I have disagreed about this in the past, Peter, about this business about influence. How do you influence government? And we're always told, don't offend, get to know, build relationships, you can influence the quiet corridors of power. And in all my experience in the sector, and when you look at the history of voluntary activity, that is absolute bullshit. Typically, what will happen is governments respond to public opinion. So I say to my chief exec mates, go there and make a fuss, get in the media, because I promise you, you can have a meeting with the Secretary of State, with Wes Streeting, and have a really positive conversation. He's got to deal with a whole load of other shit. So he's then got to make his own decision about how he's going to prioritise, which is his job. That's what he's paid to do. If you want to get him to push yours at the priority list, you've got to say children matter, or people with osteoporosis who are suffering horribly because they're not getting the treatment and support they deserve. our job to do that. Now, it's tough. This is what comes with the gig of being a minister. It is absolutely not the job of charities to be so sympathetic to how hard it is to be a government minister that we have to downplay our own cause. And the thing about money, Peter, money to ask for it, that they want to help the NHS or whatever particular government department is, because this isn't just charities that support the NHS, this is environment, this is education, you've already referred to, then there's nothing worse than pretending you don't need money. The fact that you're on the receiving end of it is tough. I don't think you've read, Andrew Marr wrote a brilliant book called My Trade. You know Andrew Marr, the broadcaster, journalist
Yeah,
chap?
you've mentioned this before.
It's a fantastic book. There's a particular section in it that's always stuck out to me. And in fact, I think I referenced it in one of my books, Tough at the Top, maybe. He talks about, as being a political journalist, there's a real problem, there's a real challenge there, because you want to get really close to people in power so that you've got access to information, you know what's going on. But he says, the problem is the closer you get, the more sympathetic you become. So you actually lose your ability to critique, to really, to argue, to tear apart ideas or whatever, because you understand it. I get it's a hard job, but it is not any of our job in our charitable sector to say it's a really hard job, let's not pester him. It is our job absolutely to deliver for our beneficiaries. And if there's politics involved, fine. If there's a cleverer way we can write to the Treasury that will make them pay attention to us, then, at DSE, we'll teach people how to do that. We run an Engage conference, we publish a book on campaigning. But the reality is when it comes down to it, I don't feel sorry for him. It's a tough job, I get it, but it's not our job to do his job for him. It's our job to fight for our beneficiaries. So that's why I think I don't agree with you about that. I think,
well, I think you're making a slightly different point, though. I am not saying we should be nice to government ministers and we should be tolerant and sympathetic to how difficult his or her job is. Absolutely not. I think there's nothing wrong, and I absolutely admire, and I'm in the camp of making a very loud fuss about people who are being failed as a consequence, and all the time at the NSPCC, I was always trying to think about how are we walking towards the children who are least likely to be helped at the moment, because they deserve us the most. So this isn't about being sympathetic and putting an arm around shoulder, all that. It's more, I suppose, just posing the question. We are very quick to criticise the government for being siloed and single-issued and not joined up and appreciating and understanding the realities of how lives fit together. So we just need to be a little bit careful as a sector, at the same time as celebrating that absolute forensic focus on charitable purpose and giving voice to the people or the issue that we seek to support, with translating that into
how that's it. So I don't understand it. I don't understand what the Royal Osteoporosis Society or NSPCC or Macmillan or Alzheimer's or Mind should do differently to what they currently do. I don't. So tell me how. What exactly do you mean?
Well,
okay. That looks like?
Well, so I don't. So I can't. I don't know what the Royal Osteoporosis Society have or haven't done, but I have seen lots. If all you do as a charity is shout very loudly that particular people are being failed and therefore they need more money, that is okay. But it's unlikely, I think, to be as effective as understanding the context and the influences that will help change attitudes and behaviours and priorities. So when you're sitting in the centre of government, if all you're receiving is lots and lots of people shouting loudly about do more for these people, it is difficult to make the priority judgments, and you're never going to be able to please all the people all the time. So there's a sort of sophistication of evidence that you need to kind of develop beyond being single issue champions. But in saying that, I don't want to downplay, because I agree with you 100%. The role of the charity should be focused on the charitable purpose, and it's absolutely fundamental that we give voice to people who aren't being heard, because if we don't, who will? I guess it's when you move from that aspect of what the charity sector is seeking to do to the kind of transformation and system reform aspect of what we are trying to do, where if we want to be co-producers of solutions, we have to listen to and appreciate one another's context. And that does mean sitting around the table with one another and not just seeing who can shout the loudest to attract the Secretary of State's attention because their cause is more important than anyone else's.
Tactics, Peter, that's not fundamental principles. Well, I think we're talking here really about fundamental principles and how the state views the sector. And if the Secretary of State generally viewed us as co-producers, as partners in delivery, then he would be doing that, and he's not. You know, he's the one who's singling out and naming individual charities and then suddenly rolling back, because I'm guessing Lisa Nandy or the Prime Minister, you know, took him into a room, pinned him up against a wall and said, what the hell are you doing, Wes? You're ruining, you know, one of our major things to get the sector on side. So I absolutely get that to a certain degree, of course, but it's, I come to say they're two different jobs. They're absolutely two different jobs. And also this notion that quiet influencing worked. I just show me examples. Most of the major changes we've made in the sector in terms of changes to law or legislation or even changes to funding have been when we've made a public fuss, when we've nagged. I mean, he wants to break the stranglehold of lobbying, or whatever the phrase was, Peter. It was something like that. I'm like, that's ridiculous. What does he think we're supposed to do? Not tell government when we think they got it wrong, not say these are the things that need to happen in order to create change. And in terms of money, you know, the fact is, particularly the thing about NHS charities, but charities across the piece, we're doing their work for them. Where do you expect us to get that money from? Now, most of us, NSPCC, you largely, I mean, I can't remember, but you would know better than I, most of your, you know, the bulk of your income came from public fundraising, didn't it? And you might have had the odd government grant or contract.
90%.
Yeah, exactly. It comes from public fundraising. So the public is already paying into the NHS. Oh, sorry, not into the NHS. It's already paying for children's services and youth services and education. On top of that, the money that isn't taxed, they're also then giving to charities like the NSPCC and all the rest of it. So we have a duty to those people as well with taxpayers' money. So it's just, because I don't know if you've seen, you know, this is sort of relevant, but I can't remember which local council it is, but there's a local council that's taken off a £1.5 million contract away from a charity that distributes money to people with disabilities, and given it to a private sector company. It was published yesterday. It was a story yesterday's third sector, I think, or today's. And that is, so the authority said it's because it's better value for taxpayers' money. But my line is like, well, I'm say to value for the taxpayer to pay a private sector company whose job is to make a profit, and there's nothing wrong with that. So I'm not anti-profit. We need companies to run business and make profits, to pay tax, to invest, to etc. But at some point along the line, there's an owner or shareholder who's going to have a villa in Portugal, who's going to have a Mercedes Benz, who's going to live in a massive mansion. How is that a good use of taxpayers' money versus that money going to a charity whose vested interest is in the actual beneficiaries? This business can't make a profit out of it, walks away, and you would expect it to, because that's the job of a business. You need to make money, and if you're delivering a piece of work that's not making you money, you will walk away from it. But charity is different. We don't walk away. We find other ways to deliver. Our commitment is to the beneficiaries, not to the generation of the money. And if the Treasury and the government cannot see the massive distinction between those two things, we need money to do our work. We cannot do our work without money. The private sector it's not getting money to do its work. It's selling a thing in order to make money, so it's got profit. And again, I'm not making a value judgment about that. That's absolutely fine, but they're not the same model. And I think that's also part of the problem. It seems like charities are beggars, but businesses are investors. And of course, it's just such a wrong way of looking at it, because charities are also investing in the economy, investing in structures, you know, so taking the burden away from the taxpayer. by attracting volunteers, by attracting donations and things like that. So there's just this, and I don't understand it, Peter. Why is there such a misunderstanding of that economic model?
Yeah.
Anyway,
So no,
I'm banging on
okay.
today.
So just to amplify now, I'm going to amplify a couple of your points, because I do agree with you. There's some fundamental, whether they're deliberate misunderstandings or ignorance of how the sector works. When the national insurance employer contributions came on, we could all see straight away that hospices were going to have to pay this extra cost, and they are supplementing what the NHS is doing anyway. And there are all sorts of other examples, and I don't think the people who made that decision understood or appreciated at all the contribution, in human terms, that civil society was making. So that immediately required an additional fundraising requirement or diminution of the outcome. On the contracting business, I mean, where do you start? I can remember a contract which the NSPCC chose not to go for because it was priced at a ludicrous level, that we could not possibly deliver what was required in an area which we knew an awful lot about. It's given to a private company. Sure enough, within 6 months, they've walked away from it because they can't deliver what's required. And then, blow me, the government comes to us and says, "Oh, you've got all these materials. Could you help us out? Because we're supposed to be meeting this particular need, but the contractor has let us down." And you can't, as a charity, walk away from that situation because you want to help the people. At the same time, I mean, that is basic exploitation, isn't it, of our sector? You're willing to pay these people over here something which it turns out is not sufficient to deliver. And when it all goes wrong, you've lost that money, but you shamelessly then come and say, "Oh, you people could do it, couldn't you? And perhaps you'd like to do it for nothing." So,
I know.
I
don't know. Do we break that, Peter? How do we? Because we have ministers in the government, in the current government, who come from our sector. So you'd think, yes, I generally think Lisa Nandy gets it, because she comes from our sector, and I think there are a number of others who do as well. But how do you really get that understanding? And like, says, we're helping you. We're literally helping you. We're helping the economy because we're saving the taxpayers shed loads of money. And like it's already been £365 million a year NHS charities contribute to the NHS. If we weren't there doing that work, they would have to find an additional £365 million to do, and that's just headline charities. So I don't know how to get through to them, how to doing what I'm doing, which is publicly shouting and saying, "You idiots, for God's sake, will you please just pay attention?"
Yeah, I mean, this is why the covenant conversations are important, and if they were meaningful, then it is through creating the respective conditions for operating and appreciating one another where we will make progress. My cynicism there, and we touched on this on a previous podcast, I suppose, is that the risk is it's the sector talking to the sector about the sector with a government minister who sponsors the sector, while the conversations where the real action is taking place, how are we going to generate growth in this country? How are we going to reset the NHS for the challenges it faces to be a genuinely more preventative, community-based model? I mean, Wes Streeting does exactly the right things about its kind of targets, and there's so much which our sector can contribute there. But it's almost those are different conversations from the kind of theory of the sector conversations that take place somewhere else. So that they do have to be brought together. So there's work to be done. Anyway, no, I'm glad you're banging the drum, and I suppose I'm trying to put forward some counter arguments, really, because I just think we are, as a sector, we can contribute so much more than
So much more.
making noise and vocalizing the perspectives of those who are being failed at the moment is necessary but not sufficient to achieve the transformation that we both desire.
Well, that's why it's quite handy, the Director of Social Change, because we're not a membership body, we just serve the sector on the whole. And so we can say things that other sector leaders really would like to say but can't, because they're worried about damaging the relationship or suddenly having funding withdrawn or stuff like that. And we're proud that we're able to do that. And I'm super lucky that I have a board that says, go, Deborah, go. Say it more, say it louder, swear a bit more. You know, I'm incredibly lucky by that. So I don't mind the fact that we're the ones who have to say it, because in a sense, we're giving voice to those in the sector who themselves don't feel they have a voice, particularly the medium-sized, smaller charities who don't have the power and might of, for example, the NSPCC or Alzheimer's or those bigger charities who can. So we're kind of proud to do that. And of course, as you know, Peter, DSC does loads of, you know, we do training on campaigning and influencing policymakers, and we publish books on it. And, you know, our director of policy research, Jay Kennedy, is absolutely brilliant at providing advice and support and information about sector issues. So I'm really proud that we're able to do that, actually, and we will keep on doing it. Although, you know, I don't think the government listens to us at all, but I kind of don't mind about that, because what it does is it fires up the rest of the sector, and they start speaking and they start feeling brave enough to go and have those tougher conversations. So in a way, what I see us at DSC doing is kind of giving permission, in a sense, for charities to be braver and bolder and more outspoken and more challenging.
Yeah. I don't, one other thing I don't agree with you on is that you have to make a lot of noise and get cross with people to achieve change. And that there are, and I've had arguments with my trustees about this in the past, and lots of people will argue that the NSPCC's greatest strength is its independence and authority, and because of the way it's funded, it can and should make a lot of noise and be argumentative. And there are definitely things to be argumentative about publicly, but there are also ways of achieving change behind the scenes and influencing people, helping point out where change could be made, and giving others credit for things which, you know, seeds which you've planted into their minds. And I could reel off lots and lots of examples of change that has been achieved, maybe not kind of transformational change and in the big picture ways we've been talking about this morning, but all sorts of bits of influence behind the scenes that, if the charity had shouted about them publicly, would have led to more polarized positions than working with and through behind the scenes. So I think a really good public affairs policy influencing function is all the time asking itself, what is it? What do we need to say and challenge on publicly, and where and who are the people do we need to influence, and what are the ways that are most likely to shift their mindset? And sometimes it's through having a bloody great public row about it, but sometimes it's about helping them.
And the point is, Peter, I don't think it's either or.
No,
it's just the message we tend to get from governments of all persuasions is, it won't work if you shout at us, come and talk to us quietly. And we know that's not true. You have to shout, you have to influence, you have to take someone out for a cup of tea, you have to, you know, get to know their son's tutor at university, you have to be married to the second cousin of your best mate. You know, we have to do all of those things. But we are constantly told that we can do those things, but we're not allowed to shout. And my line is, shouting is part of the mix. Anyway, I think we've run out of time.
Okay, well, let's stop then. There's so much more. We could go on there, but there you go. Yes, people have probably heard enough of us for now. Great. Well, who knows what a government minister will have said by this time next week, and what we'll be talking about next time. But always great to see you.
All right, and you too, Peter. Bye, listeners.
Take care. Bye.